individuals that are looking to get high on opioids will usually chain naloxone to them. So in that case, if they are getting an overdose or suffering from an overdose, and if someone recognizes it, they could see that there's naloxone right there to use them. And these are, again, all anecdotal studies. But since it's just so easy to get, some may even argue that individuals may be less scared in a way to get high on opioids because they believe that they have easy access to naloxone and they could just carry it with them. So if they were ever to suffer from an overdose, as long as someone can recognize it and they see the medication, they can be rescued.
So is there any training for the people in the community or medical residents to be able to administer Narcan?
Great question. So this is something as a medical professional that I am very passionate about, both educating current medical staff and also our communities. So let's first talk about communities. There's constant work by the American Medical Association where they develop workshops and PowerPoints that really talks about how you can empower your own community to fight against the opioid overdose. And this will talk everything about the different statistics about overdoses to how to administer Narcan and recognize an opioid overdose. So that's one thing that the American Medical Association and many state medical societies have implemented in their resource packets to the community. As for medical students, we often have training that, depending on different rotations, that will talk about naloxone. It depends, again, this is very school specific, state specific, if you get adequately trained on administering naloxone, but at the very least, medical students know how to recognize an opioid crisis and what the treatment is. And this was something I was very passionate about as I worked with the American Medical Association to implement naloxone training into the basic life support or the BLS certification program. So the BLS certification programs, most students, medical students or EMTs, any healthcare professional usually are BLS certified. And what this proposition was, let's implement this training of recognizing an opioid overdose and how to properly administer Narcan into the BLS certification program so everyone is trained. And this is, again, something I was very passionate about that was unanimously passed at the American Medical Association last June. Which I'm absolutely proud of, that this is something that the AMA, the American Heart Association, and other stakeholders do believe is important in our community.
Yes, I completely agree. It's super important that education is being progressed and we are being able to develop more efficient ways to combat opioid overdoses. So after someone gives naloxone, how do they alert, or who do they alert after they give the overdose?
Sure, great question. I believe all these people who do suffer an overdose need medical attention right away. So that's great if you treat them with naloxone and you have the essential rescue drug, but it's important to call 911. It's important to get them to the emergency center to make sure the rest of their vitals are okay, right? If you don't have oxygen, think about this. So many different organs in your body depend on your for them getting oxygen. Now, with an opioid overdose, you are starving your organs and two of your major organs, the heart and the brain, of oxygen, right? So what happens here are I'll use some fancy terminology, but you can get something called a stroke or ischemia of these areas in your body, so in your major organs. And that's what we really do want to make sure that this isn't going on, right? We want to make sure that their oxygen is coming back up, right? Often, if you give one dose of naloxone, that may not be enough. And this is what I would encourage everyone to do is, after you give the one dose, and if they haven't responded, give one more. Often, most people need actually 2 doses of naloxone. So don't stop at 1. But regardless, call authorities, call 911, seek medical attention, because they absolutely do need it. And we want to make sure that they are not just getting taken care of momentarily, but this is something, if it is a problem, we would like to intervene in the long term. Is rehab an answer? Maybe. Do we have to give other safer medications, such as buprenorphine or methadone? We don't know, but that's something, as physicians, medical students, we often think about what's the best way we can care for this patient.
So you mentioned how important it is to call an ambulance once giving naloxone, but should we call the ambulance first, or should we give the naloxone first?
I say that happens simultaneously. You call 911 and you do both. Obviously, you want to give them naloxone. If you see it right away, if there's multiple people around the area, you tell someone to call 911 and you give while you're administering the naloxone. Again, naloxone, you just want to make sure you're doing it appropriately. There's steps and great tutorials on how to administer it appropriately. So you want to make sure you're doing that, and you can have someone else call 911. If it's only you at the scene, I would call 911 while you give naloxone. So just dial 911, have them on speaker while you're administering naloxone.
So how long does naloxone take to work, and what effect should we be seeing in the patient for the after the naloxone is being administered?
Sure. So you should see immediate breathing. So naloxone will slow if it is working, and if it in fact is an overdose, then naloxone, after administering it, will kind of rescue them from that overdose, and you should see their oxygen go up. And again, if you don't have those vital signs, right, clinically, you would just see them not gasping for air if they're awake, or if they're unawake, if the naloxone has gone into their lungs appropriately, they just start breathing again. So that's a good way to check if naloxone is working. And one thing to touch upon with naloxone is that naloxone often needs 2 doses, as we mentioned. But if, let's say, after the second dose, if it doesn't work, you should start, and if they don't have a pulse, start CPR, right? If you are CPR trained, start that. Definitely, this is why it's so important to have an ambulance and 911 be called, because if they go further into this crisis, you want to make sure you have trained and certified medical professionals at the patient's side to treat, either if it may be CPR or rescue breathing.
So, can you develop an immunity or tolerance towards naloxone after repeated usage?
There's definitely an argument with this question. Most people believe that you cannot develop any type of immunity or tolerance to naloxone, that it can be used effectively on the first dose as if it was the 20th overdose. So it doesn't matter. Again, there is obviously another side that says that if they've used it multiple times, you can. But if you go on drugabuse.org and other .gov literature, you can check more on this. That really does say that naloxone does not produce tolerance or any physical, physiological, psychological dependence.
So, are there any side effects or negative effects for naloxone?
Nothing that you should be worried about in a rescue situation. Mostly, since naloxone reverses opioid effects, they may get the opioid withdrawal symptoms such as nausea, vomiting, diarrhea, stomach pain, tremors, nervousness, restlessness, maybe fast heart rate, pounding heartbeats, increased blood pressure. So you may see a lot of these symptoms, and that's mostly because you're getting the withdrawal effects of opioids. So it's like you're taking away, right? Opioids decrease the central and respiratory systems. And if you take away that inhibition, things kind of shoot right back up, and your body may go into overdrive.
So, how has the recent COVID-19 pandemic affected the way Narcan can be used and is being used in the field?
That's a great question. Definitely COVID-19 has changed on how a lot of people and medical professionals have used naloxone. And this is very state dependent. So with COVID-19, one thing that we know about is that where people are worried about are that it can be transmitted via air droplets, right? So we really, as medical professionals, we really want to be covered by wearing an N95 mask, a surgical mask, any other type of protective equipment that we can, so we don't transmit the disease. In if someone has an opioid crisis and if you're giving them naloxone, you really have to get in their personal space and making sure that you're administering it right. You're, in a way, you have personal contact with the patient. So if you don't have that protective equipment, it's very easy to feel afraid and scared to actually treat a patient with an opioid overdose. So COVID-19 has definitely changed in how we treat, but again, as physicians, we take an oath to treat our patients. Obviously, keeping ourselves safe is a priority, so we can continue to treat patients. So we try to put masks and other protective equipment on before we go ahead and treat them. In instances like New York and New Jersey, where when COVID hit initially, there was a large shortage of PPE. So this is where people felt unsafe treating individuals suffering from an opioid overdose. So that was just something that medical professionals did kind of take into account, that if they're not protected, do they feel comfortable getting into someone's facial area where they may be exposed to COVID.
Right. So as mentioned by Dr. Jain, knowing how to use Narcan is extremely important, especially with the recent rise in the opioid epidemic. I would like to thoroughly thank Dr. Jain for sharing his valuable knowledge and experience, as I'm sure it will help many people, and I'm sure will increase the education on the use of Narcan. I'd also like to thank Raiyaan Shaik for recording this podcast and writing questions, and Eli Engler for editing the podcast and helping to write the questions.